So now I'm going to explain how the ARFID companion can effectively help you, and we'll be using CBT-AR, so Cognitive Behavioral Therapy for ARFID. What is CBT-AR? It is a specialized form of therapy designed specifically to help people with Avoidant Restrictive Food Intake Disorder. It focuses on 3 main goals. So changing the way you think about food, gradually introducing foods as well, and also building skills to manage anxiety during meals. So this course is built around the 3 core components of ARFID, so that by the end of the course, the ARFID companion, you'll have the tools that you need to expand on food choices, reduce your anxiety, and feel healthier overall. Okay, so now we're going to take a closer look at how we're going to weave those key components into the course. So with cognitive restructuring the way you think around food, we're going to help you catch, check, and change your negative thoughts that you often have about food. So for example, you might think, I can't eat that, I will choke. We'll work together and challenge that thought, replace it with something more balanced, like I can take a small, safe bite and completely reduce the risk of choking. I don't know, we'll make it sound more like what it's like for you. So over time, shifting this thinking basically will help you feel more confident about eating. And we'll be practicing this during sessions over and over again until practice helps you feel more confident. So this is what we call exposure therapy, one of the most important parts of CBT-AR. So we're gradually going to introduce the food that you fear or avoid. We'll start with small, manageable steps. So like before, when I was talking about sensory sensitivity, rather than taking a bite straight away, I tried to help you build your confidence, but we'll do this with a lot more throughout this process, by not just immediately taking a bite of the food, but actually by starting by looking at the food, touching the food, smelling it, tasting it, and then chewing it and maybe swallowing it. So it's a slow but steady way to reduce fear. Managing anxiety is also a huge focus of CBT-AR. You will learn techniques like deep breathing, mindfulness, and also progressive muscle relaxation to help you stay calm during meals. And also these tools will be essential for facing new and challenging foods, and they'll be helping you build the confidence to manage the food-related anxiety that you experience. Trying new food, by doing this, you might practice deep breathing or muscle relaxation before eating to help your body and mind stay calm. These skills are transferable to all areas of your life. So by the end of this program, you can expect more food variety. You'll gradually increase the numbers of food that you feel safe and comfortable eating. You can expect to have less anxiety around food. Your fear and stress about mealtimes will begin to fade. You can expect to have better physical health. As your diet improves, you'll feel more energized and healthier. You can also expect to feel better about your social life. It will improve. You'll feel confident when eating with others, joining social events, and involving food. Remember, this is a gradual process. It can take up to 40 weeks, almost a year. So that's why you have access to this course for a year. But even though you're taking small steps, every single one of those steps is bringing you closer to feeling better. And remember those benefits that I've just listed off. Okay. This course is not about forcing you to eat unusual foods. Okay. It's not about making you change your personality. It's not about force feeding or pressuring you to eat more than you're comfortable with. This course is about taking small steps, increasing your confidence, building that so that you can feel supported and not judged about those small steps you're taking towards eating more food. The goal is to help you feel more comfortable with food and not to overwhelm you. Okay, so like I said, this course could be taken over a year, but typically it takes 20 to 30 sessions, maybe 20 to 30 weeks, and it's broken down into 4 different stages. So the first one is learning about ARFID and making early changes. The second stage, continue early changes and set big goals. So increasing the amount of food you're eating, introducing more food variety. The third stage, facing your fears. So exposure therapy really comes into play here. The fourth and final stage, prevent relapse. So it's all about maintaining your progress, helping you leave this program knowing that you can keep those positive changes going. So I guess using this program, what you need to remember is to take your time. You need to remember to practice daily, track your progress, keep a journal. Be patient with yourself, please, because we are not here because this is an easy process. We're here because this is super hard. So now it's okay to have setbacks. Every small step is a small step forward. So make sure that you share this process with at least one other person so you can celebrate your successes. So remember, the ARFID Companion is designed to help you make gradual, meaningful changes. Thank you so much.